Hi friends, coming back to the series of INICET recall exams, question that we are doing. Again, question from November 2022 exam. Identify the image given below. So this was the image given and you had to choose from Battledore, succinsurate, bilobe to circumvallate. So there are different variations of placenta that are seen. So let's deal with each of them and then we'll come back to the answers. So, okay, so what is the Battledore placenta, right? So I've taken this one um, image from Netters, and this is the Battledore placenta. So basically, what happens is in the placenta, the umbilical cord is supposed to attach to the center, right? So this is where the umbilical cord is supposed to get attached. But instead, if instead of the center of the placental mass, it comes attached to the margin of the placental mass, then it is called Battledore placenta. Okay. This is the Battledore placenta, wherein the umbilical cord is going to the margin, and the vessels and the arteries and veins will also come attached over here. So to the margin of the placental mass, it is getting attached. This is Battledore placenta. Okay. Now the next one we have is next option we had is succinsurate placenta. Okay. So coming back to this diagram, so this is the succinsurate, and I don't know if you can see the writing, it's so small. So this is basically this is a succinsurate placenta. Okay. Okay. So what is a succinsurate placenta? So succinsurate placenta is basically where you have one placenta, right? And you have another placenta. Okay. So you have one placenta and there are vessels going into it, and then there are some minute vessels also connecting this to the other placenta. So what is the importance of succinsurate placenta? So basically it can lead to secondary PPH, right? So what is secondary PPH? That more than 24 hours after delivery to 12 weeks, there is bleeding, right? So this is very important because PPH is one of the common causal factors for a maternal mortality. So once you take out the after delivery you take out the placenta and you have removed this placenta supposing and you are happy, okay, like it's done and the baby is out, the placenta is out. After some time you can send the patient home, right, with the healthy baby. But what if she comes the next day with bleeding and you realize that there's a part of the lobe that is still left behind, which is causing the secondary PPH, which was unexpected. Okay, so that case, it is very important. This retained bit of placenta will lead to secondary PPH. So you need to make sure that all the bits of placenta are out and it is, she's not going back home with the retained placenta. So that is very important. Next, the next option was bilobe. Now, what is a bilobed placenta? I don't have the image here because this was the answer. This is a bilobed placenta. So the answer was C. What happens in bilobed placenta is that there are two masses of the placenta, which was almost of the equal size. You can almost say this is like a butterfly that is forming. So they are almost two equal halves of the placenta that are there, which are attached together. Okay, so it is somewhat like succinsurate, but over here, the masses, there's like one big mass and then there's a small mass. Over here, there's almost the equal size masses that are there together. So the answer is a bilobed placenta. Now coming to the next, that is the circumvallate placenta. Okay, so as you can see, this is the circumvallate placenta. So now I'll explain what is circumvallate. Okay, so what happens in uh, uh, placenta? There's a fetal side and there is a maternal side. Okay, so what happens is uh, if the placenta has a big maternal side, but the fetal side is very small, okay, so the membranes will roll over it. Okay, as you can see, the placenta is covered by this fold of chorioamniotic membrane around it. So this is called a circumvallate placenta, where the chorionic plate on the fetal side is smaller than the basal plate on the maternal side. Okay, so the amnion and chorion are being folded and rolled back to form a ring, leaving a rim of uncovered placenta. So this ring is being formed and the rim of uncovered placenta is left behind. I hope you're getting it. So this is the circumvallate placenta, right? So obviously, this is not that. And coming to the last one that we can see here, this is velamentous placenta. So as I told you before, when we were dealing with battle two placenta, that the umbilical cord is inserting into the margin. That was battle two. What happens here in the placental velamentous placenta is that the vessels vessels are basically inserting into the chorioamniotic membrane and then inserting into the placental mass. Okay, basically cord insert into this chorioamniotic membrane instead of the see this is, till here you have the umbilical cord, so it should have gone completely into the placental mass. That is not happening. What is happening instead is the vessels from these umbilical cord are going into the chorioamniotic membrane, and this chorioamniotic membrane is then going to the placental mass. Okay, so that is what is velamentous insertion, and this is generally associated with vasa previa, right? So you need to diagnose it, otherwise it will lead to fetal mortality. Okay, and besides that, the circumvallate placenta, I want you to again look at this. The circumvallate placenta is associated with mostly FGR, like IUGR patients and preterm, okay, patients, and also in some cases APH. So these are the clinical significance, right? So you have the different types of placenta. So bilobed or succinsurate can lead to secondary PPH, right? Circumvallate can lead to IUGR patients mostly, or they are associated with them. Okay, and then the filamentous placenta is associated with vasoplegia. So these are the clinical correlations of these placental variations. So I hope you understood, and if there is any query, you can write down in the comments. Okay, bye bye.